God has given me everything: health, a loving family, wealth, lot of fame, and these things are great blessings that are coming from Almighty. I really appreciate that. But beyond that, there are other things which give you happiness. As a doctor, I get a lot of feedback from patients, and many of them make you cry actually. Many times, people just express it by a smile or maybe a tear. One of my treasured possessions, which I have kept at the top of my certificates, even above my gold medal certificate from Calicut Medical College, is the letter from the patient's brother who has died under our care. Still, the family feels that I and the doctors along with me have done something. So that is the greatest satisfaction for a doctor. Unfortunately, over the last many years, I have lost that opportunity to have this because I don't practice nowadays. But I am happy that along with people around me, the doctors, nurses and the other people, in the last 15-20 years, I have been able to make a large force who are able to provide this to millions of people. So I always feel that the best exercise for the heart is to lift somebody who is in need.
In March 2008, I lost my eyesight. One night, all of a sudden, I felt nauseous and dizzy. I was rushed to the hospital where I was diagnosed with optic neuropathy. Within 6 hours, I was blind. Soon enough, I lost my job and the bills started to pile up. As time went by, I became depressed and lonely. Out of the blue in February 2009, Dr. Azad Moopen called me up. He arranged a Nokia N97 mobile for me with a software called Talks. It changed my life. Suddenly I could communicate with people. I could hear who was calling me. In 2015, Dr. Moopen asked me to speak about my life experiences to Aster's new employees. That was the beginning of a new journey. From someone who needed motivation, I have become someone who delivers motivational speeches. Dr. Moopen brought light into my life.
I've been lucky as a child to watch my father, who was a social activist, and he used to help people. And there are a lot of people who have inspired me. One such person is Dr. APJ Abdul Kalam. We are a very successful commercial organization, but the philosophy behind it is that you have to help people, because profit in healthcare has to be a byproduct.
Back in December 2011, my doctors in India told me I had only 6 months to live, but I am still alive because of God's grace, Aster and Dr. Moopen. My life changed when I was diagnosed with breast cancer in 2004. Within a year of my diagnosis, my husband left me. My son was only 7 years old. In 2009, the cancer recurred in my bones. In January 2011, it spread to my lungs. By 2012, I was looking for another job as the company I worked for closed down. Many were happy to hire me, but when they came to know that I was a cancer patient and would have to undergo chemotherapy every month, they all backed out. Then I approached Aster. Dr. Moopen was very understanding and kind, and he offered me a job. Initially, the chemotherapy was for every 21 days, but for the past 2 years, I've been going every week. My former company used to cut my salary for the days I would take off. Aster doesn't cut anything. Also, when I found it difficult to raise money for my son's education, Dr. Moopen stepped in without any hesitation. Today, my son is a BSc graduate in information technology. My dream has come true. The cancer may have spread to other parts of my body, but my son will now be able to stand on his own 2 feet.
I have already announced publicly that I will keep aside 20% of my wealth, that is 1/5. I have 3 children and my wife, and the 5th heir to my wealth is the people who are in need. Giving back is something which is very close to our heart, and the people in the organization also are deeply involved in that. So we thought that in the 30th year of our existence, which is this year, we should look at giving back through Aster volunteers. I spend now maybe 20% of my wealth and 20% of my time on that. But maybe after 5 years, 10 years, when I am able to get out of the business and when others are running it, I'll be spending 80% of my time for this. That I think will produce a tremendous impact.